this is an interesting story, and it's just popped in my mind. I volunteered. I had a patient that ran one of the Optimist groups, Miramar Optimist, very close to my practice, and they did physicals. So I said, you know what? I'll come do the physicals. Typically, you have to go to the doctor, your primary, and get a physical, and they charge you. And I said, I'll come, and I'm not going to charge anything. So I'd go to there, and I'd do it in 3 nights. I'd see all the kids, and it wasn't the most ideal conditions, and so I would take their blood pressure, I would listen to their heart, I would take their resting heartbeat, I would take a questionnaire, some basic stuff. And if I didn't feel comfortable passing them from the physical exam that I did, I'd send them back to their primary. But most of the kids I did. I had one kid that was really heavy and a super sweet kid, but his blood pressure was really high. He was 10 years old.
Oh
He
my
was
God, high
very
blood pressure at
overweight.
such a young age.
Yes, he had a high heart rate, and so I failed him. And I tell all the kids I fail, I'd be glad to, let your mom know or dad, and I'd be glad to talk to him. So she comes in, and I said, listen, I think your son is capable of playing football. But in this environment and these circumstances with high blood pressure, he's 10 years old, high heart rate, he's obese, let's just go. I'm sure he'll get cleared, but I'd feel better, right? Okay, so I finished that day. The next day, I get a call, and Rita, my office manager, says, oh, there's this lady that you saw her son at the Optimist. She has a workman's comp case. She was so impressed that you took the time to talk to her about her son, and that she wanted you to treat her for her work comp injuries.
Wow.
And that lady went on to probably refer over 100 people to me in the next 10, 15 years.